Good evening, everybody, and thank you for joining us this evening for the webinar, which is being hosted by AHDB Beef&Lamb. My name is Katie Thorley, and I'm Knowledge Transfer Manager for Beef&Lamb within AHDB. I'm delighted to bring you tonight's webinar on responsible use of antibiotics at lambing time. Our presenter this evening is Dr. Fiona Lovatt from Flock Health Ltd. Fiona has worked as a farm vet in practice for many years before setting up Flock Health Ltd and working as a consultant for the past 4 years. The plan of action this evening is that Fiona will run through her presentation and there'll be time for questions at the end. You will all stay muted throughout the webinar, but if anyone would like to ask a question or any time throughout the presentation, if you think of a question, if you type it in the questions box on the right-hand side, I will ask them at the end of the presentation. We've got over 300 people registered for tonight's webinar, and we'd like to thank Elena, who's working behind the scenes to endeavour this all runs smoothly. But please bear with us if we do encounter any technical difficulties, but hopefully these will be kept to a minimum. So without further delay, I'll hand you over to Fiona for this evening's webinar.
Okay, thank you, Katie. That's great. Can I just say it's responsible use of antibiotics at lambing time, just to stress that. So, and we're delighted that we're sort of coordinating with AHDB and our Flock Health Clubs. So for those of you who don't know, and I'll just run through this very, very briefly, Flock Health Clubs are vet-centred groups for learning and discussion, groups of sheep farmers paying a monthly subscription with an encouragement in the group to record, to benchmark, and to improve each of those producers' farms. And we found that they're really, for those practices that have set them up and embraced them, enhancing relationships between sheep farmers and their vets. So we know we've got over 40 running in the UK, but also Ireland, Norway, Canada. So it's sort of, the concept's taken off anyway. So that's all I'm going to say about Flock Health Clubs. But this webinar particularly is directed at people who are maybe running a club and may want to take these slides and take them and run them within your club. We've also got a set of slides where there are just 10 to 12 slides. It's a very, very simplified version that you might want to have for a larger client meeting. And AHDB can make those available to people who request them, over the next few days. So where this has come from are RUMA's responsible use of medicine, and most particularly the responsible use of antibiotics. And you'll be well aware that over the last over the last year, we've set up these targets. The RUMA Targets Task Force has put targets in for each of the different agricultural sectors. I was involved with the sheep targets, and we felt very much for sheep farms, the issue is not how we use antibiotics, is not how much we use, but how we use them. So in terms of milligrams per kilogram, sheep sector actually looks pretty favourable compared to most of the other sectors, or a lot of the other sectors. But often the way we use them and the prophylactic use are areas that we could work hard on, and some of the other sectors absolutely will not use prophylactic antibiotics as a matter of course. And that's an area where in the sheep industry, we feel we particularly have to work with. So we've come up with these hotspots. One, the use in neonatal lambs, both for watery mouth and joint ill, and that is very much the focus of this webinar today. Then the control of enzootic abortion, which I will touch on, and then the control in lameness, which obviously I'm not talking about today. We're very much concentrating on antibiotic use at lambing time. So, with respect to the RUMA targets, Sheep Vet Society got together. We got 8 or 10 of us together to put together some good practice guidelines. And the sort of crux of this, what comes out is absolutely, it's totally appropriate to use antibiotics to treat clinically ill sheep in whatever we're talking about. But what is not appropriate is to use antibiotics in healthy sheep as a routine or on a just in case basis. And so the challenge there is to prevent ill animals and to stop them coming ill in the first place. And so we've got this sort of strap line which works quite well across all our antibiotic targets for the sheep sector, and that's to plan, prevent and protect animals so we don't have to use antibiotics. But I just want to stress that if you have a clinically ill animal, whether it's mastitis, whether it's lame, or a disease outbreak, it is always totally appropriate to still use antibiotics if that's what's necessary. So just to sort of recap, and people who've come to Flock Health Club events will have seen this sort of set of slides before, but what we know with sheep farms is our flock profitability. We need a maximum output from the flock, maximising the numbers of lambs sold at a minimum cost, spreading those costs over a lot of lambs and keeping our variable costs as small and efficient as possible, and having a maximum product value for the lamb. So in this, we're looking particularly at lambing time at maximum output from the flock. And when you think of the output of the flock, when you ask someone about their lambing percentage, they will always tell you what they scanned at. That is their potential, the numbers of lambs counted in those ewes at scanning time. And that is always the best figure. And you'll have heard me say it before. It always looks good to talk about your scanning figures. But at each stage where you lose lambs, you'll obviously have less born alive, you'll have less turned out, you'll have less lambs weaned. And but what the figure that's really important is the reality, how many lambs are actually sold. So the abortion and lamb deaths on the right indicates to us that that's where we're focusing in on this particular diagram. In this particular webinar, we're looking at around lambing time and the losses from between the lambs born counted at scanning and the lambs turned out of the shed. So we're particularly looking at those lambs' birth and what can make a difference in them. And primarily, we're looking at neonatal lamb disease. But when you think about lamb losses, half the losses in the lambing shed are basically half of lamb losses occur at lambing time. So 49% of lamb losses occur at lambing time, and about a third, 30%, occur between scanning and lambing. So this is the stage I said, well, I did want to talk about abortions just briefly. When you think of sheep abortions, and this is just the time of year that people are going to start, coming in and complaining of abortions, and you'll be investigating abortions within your own practices, we know that about half of those abortions are due to enzootic abortion. And we also know enzootic abortion is preventable by a single vaccination, to last 3 years or so. So often we get away with a single vaccination in a ewe's life. As you well know, you may need to give another dose later on. Even if we're just talking about replacement ewes within the national flock, we have 3.5 million replacement ewes each year in the UK flock, but we only have $1 million doses of the AHDB vaccine. So it's approximately a third, less than a third of eligible replacement ewes, not even when you're vaccinating older animals, just replacements. It's only a third of those animals are vaccinated. And what in some areas is quite prevalent is still, it seems, there are still farmers using routine antibiotic treatments in late pregnancy. So oxytetracycline in late pregnancy to control abortion. And the Sheep Vet Society Good Practice Guidelines is very clear about that. It is not acceptable to use routine oxytetracycline in late pregnancy as a control of abortion. And the only case that it is either in the face of an outbreak, i.e. this year, or if you had a confirmed diagnosis of chlamydia in the immediately preceding year. So obviously there's a case for oxytetracycline in an outbreak. You might want to protect the other ewes in the group, and you may want to protect those exposed ewes in their next pregnancy when you're expecting them to abort. But it is absolutely not acceptable to give oxytetracycline on a routine basis year in, year out. It is much more appropriate to use vaccination. So lambing time. farmers phoning up. Can I have a couple of bottles of penicillin? Can you send over 12 bottles of oxytetracycline? Can I collect some oral doses for baby lambs? Well, why do you need those from the receptionist? Well, it's lambing time. And the question is lambing time in itself an acceptable reason for the mass prescription of antibiotics to sheep farmers? And in some cases it is. But do you know exactly what antibiotics your sheep farmers are using and why they're using them? Do you think you have clients who are routinely, habitually using antibiotics, but they don't have close veterinary involvement? And bear in mind, as a prescriber, it is totally your responsibility. So we as vets are the guardians of antibiotics, and we are fully responsible for whatever antibiotics are used on our clients' farms. We kind of all know that, but sometimes it gets perhaps forgotten. So this is some work that was published just a few months ago from Nottingham, looking at the use of antibiotics in British sheep flocks. And you can see as you go right through the year, from January through to November, there's a sort of fairly consistent use of oxytetracycline through the year. And we assume that's predominantly for lameness. But then you look at those months, February and March, that massive increase is basically associated with lambing time. So we don't have particularly good detail on where those antibiotics, where exactly they're going, and that's something that we would very much like across the industry to get a better, a bit more focus on exactly what farmers are doing with antibiotics at lambing time. And there's every opportunity for you to be able to do that within your own flocks. So as you get your flocks together, whether it's in a Flock Health Club meeting or whether it's more widely for your sheep farmer clients, whether it's for when you're doing flock health planning, for each client, can you list what antibiotics were purchased last year, and why they give those antibiotics? It's, you know, it's brilliant discussion. What are farmers? Do you prescribe? Obviously, you prescribe in the practice, but do you have strict rules on what people might use and when they might use them? Have sort of protocols they cover? Are they only giving them to clinical cases? Are they using it routinely? Is it just they happen to give them a dose, an injection after every lambing, for example? Is it habitual, just in case there's a problem? Or is it more targeted? Is it treating clinical cases? So is it predominantly at lambing time? Is it for lameness? Or is it giving it to lambs for neonatal disease? It would be really great to have that sort of detail on each of your farms. And it is amazing how often you go on a farm and when you actually go into it, both the farmer and their vet are surprised at what they do use and when they use it, and no one's actually sort of kept tabs on it. If you want something to help you sort of collate this data, the University of Nottingham and AHDB have worked together on a calculator, which is fairly simple. As it's basically based on an Excel sheet. As you can see, some of you may have already seen it. You can click into this column and say the sort of route of administration, and then it comes up with a, I don't have it live working here because I thought that would just one thing too much for the webinar, but you can see you get a drop down box. You can click on the product used. You can then type in the amount used in mils. So obviously there he'd used 1.5 bottles of Alleamycin LA. Clicks that in, and then it calculates what your mix per PCU is, and it will. You can see if you look down to the Baytril max, it can tell you that's a critically important one. So it comes up in red. It's just a very simple way to log it for different farms, and then there's a further version which will then collate that data and help you show it back to your farmers and use it in a group situation. Use it for you to benchmark people against each other to get an idea of what people are using, but also it's handy. We're trying as an industry to collate this data because you know that Nottingham study I showed you before, that was only from 207 sheep-only farms. It would be great to have more detail on this, and we need that sort of detail to robustly go back to government, and we need the evidence for exactly what is used and when to be able to defend what we do within the industry. So if you're interested in getting access to this calculator and a link to the how-to guides, then please do contact AHDB on that email address, and they'll be happy to send it through to you, because it's the more data we can collect, the better, and we may as well be using it as a useful tool. So that's one thing that's really helpful to do, say at the start of a club meeting or for a wider group of clients. So thinking specifically about neonatal lamb disease, in the Sheep Vet Society Good Practice Guidelines, it very clearly says, in individual flocks and with close veterinary supervision, it may be appropriate to use targeted control measures to include antibiotic treatment. But in no flock will it be appropriate for all lambs to be treated routinely from the start of a new lambing season. And that potentially is quite a challenge to people. I'm quite sure you're aware of clients, you're aware of sheep farms where they just always give a squirt of Spectam to every lamb that's born just in case. And there are plenty of farmers who would be very nervous to not continue to do that. And that's we'll spend most of the rest of the webinar working through those sort of situations and how to deal with them. So one of the things is quite important, and so this is just a photograph of the start of a large sheet of paper, a flip chart, whatever it is. And if you can think of lambing time, think of the ewes, think of the shepherd, think of the environment, and just get people to brainstorm. What is it? What are the factors that are important to lambing success? What are the things that we can do apart from a squirt of antibiotics that can make a big difference to success at lambing time? And very much these will fall into those three things: plan, prevent, and protect. So here's one I prepared earlier, as it were, with the lamb at the bottom, and thinking very clearly of, well, to plan the shepherd in the middle, and part of his planning is going to involve the ewes. So going over to the left-hand column, we need our flock of ewes to be fit, to be in decent body condition score, and need to have a quality diet. They need to be fit and well fed for there to be decent colostrum. And we need that colostrum, as everyone very well knows. We need the quality, the quantity, and colostrum in adequate timing to protect the lambs. So the detail there in the ewes, if good body condition store, good quality diet, they need to be fully vaccinated. And I've got a case study later demonstrating that. Sound in foot, we know if you've got a lot of lame ewes, you get an increase in just disease challenge in the shed, may well get more joint ill, just because an increase in disease challenge. And the ewes need to be clean, so either winter shorn or dagged. That can make a big difference in quality of colostrum, protecting that early lamb. Back to the shepherd in the middle, planning. He kind of needs to be thinking about it, and not now, but a month or two ago, analysing the forage, arranging a proper quality diet. But then once we actually get into lambing time, the care of those newborns, making sure that they really do get the colostrum they need within the time scale they need it in, and minimising that stress in the first 24 hours. You know, just not castrating or tailing the lambs in the first 24 hours can make an enormous difference to that lamb getting on and doing the most important thing in that first day of its life, which is getting a good bellyful of colostrum, and making sure it absorbs that before 24 hours is up. And then also within the planning is the shepherd keeping good records. And we all know that record keeping on sheep farms is notoriously patchy. It makes a huge difference to know what's gone on last year and to focus in, and we'll go into some detail with that as we go on through the webinar. And then prevent, and this all sort of relates to the environment. So whether they're lambing inside or outside, they've got to be sheltered, clean, dry, draft-free, plenty of fresh bedding. If they're inside, they need to be turned out as soon as possible. If they're outside, they need to have a suitable shelter, and then hygiene needs to be at its most. It's all really dead obvious stuff. It's really helpful to have had that blank flip chart or large piece of paper and got everyone to just think what is important and to be able to focus on it, basically. So I said I'd go into Colostrum, and with the hashtag Colostrum is gold, which is a campaigns coming right across all the sectors in the next couple of months, as we're coming into lambing, aiming to focus on colostrum. There are two vital parts to colostrum. Immunoglobulins, obviously, vitally important. Now we know a used colostrum is about 50 IgG per litre at lambing time, but it declines rapidly at about 3 grams of IgG per hour over that first 24 hours. And then we also know that by the time a lamb is 1 to 1.5 days old, it can't absorb any more IgG anyway. So that there really is a race against time to get that colostrum in quick enough to allow adequate passive transfer. And then, of course, the other crucial part of colostrum is the energy it provides. So at 15% fat, we know that the lamb's energy diminishes in the first 5 hours of birth, and they actually require the majority of their colostrum simply just to keep warm. So, so it's based on those two vital parts that we get to the mantra that lambs should receive 50 mils per kilogram as soon as possible, and a total of 200 mils per kilogram before the end of the 24 hours. And we really can't focus enough on colostrum. So we need to have a plan. The best, the very best, is anything from an actual ewe herself. So any ewe that's had a single, any ewe that's lost a lamb, harvest absolutely what you can, and bear in mind that the ewe's colostrum herself is much superior. So substitute colostrum, even the very best of the powders, have less than half the IgG of a ewe's own colostrum. So it is really important, and the more we can stress that to farmers, the better. Collect it in spotlessly clean containers, keep it in the fridge for up to a week, or freeze it. But if it is frozen, as you well know, make sure they don't zap it in the microwave. But the more we can focus farmers on how crucial colostrum is, the better. Whether you want to check the quality on a Brix free fractometer, there's not a huge amount published on lamb colostrum, but a few of us have, played around with it and used cattle data, and a cutoff of about 21% works well for getting both specificity and sensitivity good, and that will equate to a value of 50 grams per litre, which is what we're aiming for. And then, of course, to check transfer, blood sampling the lambs at 2 days old is ideal. So have a plan for colostrum, and if you're needing to substitute, yes, obviously you can use cow or goat. Neither are as good as ewe, by quite a long way. So cow colostrum, for example, you need to have 30% more simply to make up the lack of energy, the difference in energy between ewe and cow colostrum. Definitely pool it because of the risk of hemolytic anemia. Make sure they're cows on the same farm if at all possible, and obviously that's not always possible, and make sure they're Clostridial vaccinated. And as I've already said, bear in mind, powdered colostrum is okay. Well, some of it's okay. Some of it's okay in the fact that it's half as good as a ewe's own colostrum. Some of it is absolute rubbish, and there have been studies. Murray Cork did a study in Cambridge a year or two back comparing powdered colostrum, and there isn't necessarily a good correlation between price and quality. So it's well worth making sure you've got decent IgG in that colostrum. But even those best, as I've already said, is only half as good as a ewe's own colostrum. So let's go on to watery mouth and antibiotics, which is the main crux of this. We know that prophylaxis against watery mouth is common and widespread. If we look into that, that little logo there, the CISS, that's a sort of sales data that pharmaceutical companies can access to see what products are sold. So we know that within 2015, there were 10.5 million doses of oral antibiotics sold for neonatal lambs. So if you extrapolate that up, it's a significant number of baby lambs in this country given oral antibiotics. And bear in mind that doesn't include, we probably estimate that 5% of farmers are still giving tablets, which do not come onto any of the data because they're not licensed in farm animals. So the VMD do not count those in MIGs for kids at all. So even if we just look at all doses, it's 10.5 million doses. So if that Nottingham study I referred to before, oral antibiotics were given to half the flocks, and 2/3 of the predicted lamb crop were given oral antibiotics. So on estimate, on the combination of doses sold and the data that we do have, I think probably there are 50% or more of the lambs born in the UK. Every single one of those receives a dose of oral antibiotics as a matter of routine. And that prophylaxis is where we need to focus in. It's not huge in volumes. So if you looked at MIGs per kg, it doesn't massively register. But in terms of practice, prophylactic treatment like that, especially giving an antibiotic into a neonatal stomach, is a classic way for resistant potentially to develop. And on such a wide scale, it's potentially hugely significant for the industry as much as anything. So I'm really hoping this animation works. I will just be quiet for a minute. Okay, so that little animation is we're using it through the RUMA targets, and as a sort of campaign on Twitter and stuff. You can access it through that, just as a sort of quick way to explain to people that we need to do more than just try and dose of antibiotics. The papers in the record, letters in the record in the last year or so of flocks where giving oral antibiotics and go through and resistant builds up, and you get to the stage there's nothing left available. So here we've got the VARS report of isolates of E. coli from neonatal lambs, susceptibility to antibiotics. And you can see very clearly if you look down the list and get to spectinomycin, and you can see that approximately half the isolates of E. coli for neonatal lambs back in 2012 were resistant to spectinomycin. And as you well know, spectrum scourhold is the most commonly used antibiotic in neonatal lambs. It's worth pointing out when you look through this list that a number of these antibiotics are either fluoroquinolones or third or fourth generation cephalosporins, another fluoroquinolone there, which are high priority, critically important antibiotics and should absolutely only be used in exceptional circumstances. So we don't use very much in the sheep sector, which we're pleased with, but we really don't want to be using any at all. And there's a big drive to not use these critically important antibiotics that are so important to human health. The only cases that you are allowed to use those high priority critically important is where you have undertaken both culture and sensitivity and they indicate there is no alternative. So I would like to stress that you have got to go through every other option first before you turn to one of the critically important. And basically, if you're having trouble controlling the disease with spectinomycin, get some diagnostics, send a bit of liver, or take a charcoal swab from an untreated lamb, find out what you're dealing with, and find out what susceptibility it is. Don't keep throwing stuff at it. But the very fact that you're taking diagnostics means that you're involved in the case. So that's the most important first case, is that vets are closely working with farmers when they have issues, that there's never a situation where antibiotics are just handed out for cases that don't work. You absolutely have to be there, have to be taking samples, and have to be fully involved with the farm to be responsible. So what about all our clients who just want to dose every lamb from birth? Now, there are a few who have a genuine and current risk of a watery mouth outbreak, and absolutely it is right for them to be using antibiotics in that situation. But we also have farmers who have had a previous outbreak and they're fearful of stopping. We've got farmers who have a perceived risk of watery mouth and they've picked that up from other farmers, but they don't actually have the problem on their farm. And then fourthly, we have farmers who genuinely believe that all lambs will benefit from antibiotic treatment, and that's something that has been picked up over the years, because that's what you do, you give a dose, and clearly that's not the case. So whichever one, you need to first start off by working out, where does this farmer fit into this picture, discuss his flock, go through the plan, prevent, protect. Is he doing everything he can? Is there anything else he can be doing? And then divide the flock into different groups. So identifying high risk and low risk lambs, targeting treatment appropriately, and allowing for changes as lambing proceeds. So a bit more detail on how we can do that. A plan for each of the flocks. So starting by dividing the flock up. So whether that's a large sheet of paper, another flip chart, work out what you've got and divide that flock into the different major groups. Then for each group, work out age, breed, where they lamb, when they lamb, divide each group as much as possible, because everything's not the same. Work out what happened last year for that group. Actually, how many cases of watery mouth were there on farm? And I think you'd be surprised at how few there often are. So last year we did a survey of scouring lambs and asked farmers how many scouring lambs, baby lambs they had scouring, and how many had watery mouths. And I was genuinely amazed that actually most farms, they're down in the single figures. It's not as if it's a huge issue. And that's very relevant. Get as much detail as possible. Numbers, when that's happening, whether it's a type of shed, whether it's a type of pen. And then, so that's the details for last year using records. But then apply risk assessments for this year as lambing proceeds. And update as you go on, and then consider how to plan, prevent and protect. So a bit more detail on that. As you go into the detail, high risk lambs are lambs in a group with recent clinical cases, triplets, low birth weight lambs, those born to thin or poorly fed ewes, those born in a challenging environmental conditions, or those born later on in the lambing period where the challenge is raised. Conversely, the lower risk ones, lambs with adequate colostrum, fit and healthy singles, those born in the first week, and good environmental conditions. There is definitely a variety of risk factors within the same flock and within groups within the same flock. So don't be fooled into thinking, oh, this farm had a problem last year, that's it, every single lamb needs a dose of oral dose before lambing, because clearly there's much more detail on it than that. So for you guys who are doing flock health clubs, or maybe you want to take on as you're doing flock health planning, you're talking this through with farmers at this stage, so before they are getting ready for lambing, actually go through and do some sort of risk assessment. And this sheet is just a very simple tick box, but and you're clearly not going to do that on every single lamb, and I'm not in any way suggesting that. But once you've grouped your lamb, once you've grouped your flock, you can get some sort of detail on it. So generally, singles of a good size, born with no problems and filled with colostrum, are are at much lower risk. And once again, we can divide it into lamb factors, ewe factors, and environmental factors. And it's just to tease the issue out and to think it's not just one homogeneous flock, it's the detail, the differences between them. And for those farms, some farmers are too scared not to pick up their 1,000 doses of Spectam and just give a dose to every lamb. Well, just persuade them in the first year, just persuade them to not dose their singles and not dose anything in the first week or something like that. Just break it down and make them think about the detail of the flock. And, you know, how far lambing can they get before they open a bottle, a dosing bottle? And some people amaze themselves, and they get to the end of the lambing and they say, you know what, I never used that bottle of Spectam. Brilliant. But they wouldn't have had the confidence to do that. And it might be that you let them have a bottle on hand, so they've got it if they're worried a problem starts. But just don't start routinely with the very first lamb. So we'll go through this case study. This is actually some scouring lambs. It was from the project we did last year. Some of you may have seen this case before. Apologies. If you have, so it's a large flock, 5,000 ewes, and they had a massive problem in shed 4. Every lamb got scour at 24 hours old. Some were very ill. Some were covered with antibiotics. They didn't have a lot of deaths, but they really went with the antibiotics. So everything got a double dose of Spectam scour halt as soon as possible. Then anything that was seen to scour got a further dose oral treatment, and also got some Sinulox by injection. I first heard about it at the end of April. The practitioner, she went and she got a sample, cultured the E. coli, and found it was resistant to spectinomycin. Okay, brilliant. So then she moved on to get hold of some neomycin and started neomycin for all the lambs. Great. Then we went in because we wanted them for this study, and actually, so I went to sample some to look at the scour. So just a reminder there, your best diagnostics is either, if it's watery mouth, send a bit of liver, or a charcoal swab from an untreated lamb is your best for looking for E. coli. The rainbow swab, the rainbow strips are great for looking at causes of neonatal scour, and you probably use them in calves. So this on that same farm was the results. Lambs listed down the left, so most of those were shed 4, and then the ones at the bottom are shed 2. They were mainly all given Spectam scour halt, a couple of doses and another dose and some Sinulox. Then they swapped onto Orijet. And the rainbow strips, so we allowed us to work out negative for rota, negative for E. coli, negative for Cryptosporidia, but as you can see at the end, they were positive for epsilon toxin. So we went in, we talked to the farm manager and asked him about it. Sorry, apologies. And, oh no, he doesn't vaccinate this flock. And actually, in that case, we're pretty sure that was lamb dysentery there, and we just controlled it. We didn't have huge deaths because of that intensive antibiotic treatment. But in that case, yes, it's right to test the scour, and yes, it's right to go in if spectinomycin isn't working, but actually check. And so the first stage of the protect the animals, protect the ewes, and make sure they're vaccinated was important. So actually, we've got a lamb dysentery issue there. Okay, I'm going to go on to joint ill, which is the other biggie for neonatal lambs, and it is a considerable issue in affected flocks. So we get a morbidity of up to 20%, and in severe cases, up to 50%. You know, I'm well aware it's hugely frustrating for the farms involved. And out of those lambs, you know, you end up euthanizing, and probably we don't euthanize as many as we should. Seeing lambs hobbling around for over a week is not acceptable. The ones that never get right should be euthanized. So we have strong evidence to suggest that strep disc galactose is the most common cause. So the studies they did back in the 90s showed that well over half the lambs that they examined after centesis, they found strep disc galactose. And just to compare, out of the 165 that they found strep disc galactose, they only found 4 lambs with erysipelas. So I will just briefly discuss erysipelas in the next slide. as you well know, it's essential to detect joint ill quickly and treat quickly. So any case which has gone for a day or two before treatment is often ends up being euthanized. And it's also really appropriate to get samples. So either tap the joint, or a post-mortem of a number of cases to work out what you're dealing with. Is it actually Streptococcus galactii? If you don't do that, I would generally suggest you assume it is Streptococcus galactii. So Streptococcus galactii, and it is a really difficult one, and there have been a number of studies looking at it, and it continues to be a really difficult one. So we know the sources, we know there's the possibility of carrier use, so they spread it in the birth canal, so the lamb picks it up in the birthing process. We know it can be picked up on teats and in milk. We know that stomach tubes or bottle teats can act as a vector to transmit it. It can be spread hands, it can be spread lambing one ewe that is a carrier and going straight across to another ewe without cleaning and disinfecting your hands and arms in between is a way to spread it between ewes. And most crucially and most annoyingly, we know it can survive well on dry straw. It's not just a problem of poor hygiene. And you will know that. You will have farms where they have really good hygiene, they're really top notch, but they still have a massive joint ill problem. And then you have got to just go into the detail. So look, apart from the detail of where the sources are, but the detail of the routes that they've entered the lamb, you know, whether it's through the nose, the mouth, the tonsils, whether it's an ear tag, and that's a common cause for Streptococcus galactii to get into lambs, where you break the skin at any place. Tail docking at the navel, and out of the studies, you know, we've got that message across, and the vast majority of people will teat navel dip in strong iodine. Make sure it is appropriate iodine, but any one of those entries might be where it's getting into the lamb. So what do we do about it? Consider all the practices that we said before: plan, protect, and prevent, as we said before. Strict hygiene, wear your gloves, wash your hands, sterilise all equipment, and then use targeted antibiotics where necessary. So that's got to be on a risk basis. You've got to be actually involved in that flock, and you've got to review it regularly. So don't get away with thinking this farm has a problem with joint ill, he has to go on and inject every single lamb every single year. That is not the case. You've got to review it regularly. And I've had a number of farmers say that to me. And I think it's a much harder nut to crack than watery mouth. But, and I'll go through the case study shortly, you do still need to be actively involved and actively reviewing it. The other most frustrating thing with it is we still see joint ill in lambs that have got their colostrum. So we couldn't pretend that, you know, everything's 100% and you won't get joint ill, because there are these really good farms that do still. What we can say is a lamb that hasn't got colostrum is going to be much more at risk of Streptococcus galactii joint ill, but doesn't necessarily work the other way around. A lamb that has got enough colostrum may still succumb. So out of the study that Rutherford and Riddler did in 2015 and 14, they looked at 36 flocks. 39% of those were already routinely using prophylactic injectable antibiotics, and they still had an issue with joint ill. More widely, so those were specific flocks chosen because of joint ill, but more widely, we think that probably 10 to 15% of farmers use prophylactic injectable antibiotics on every lamb, and will do that year on year on. And that is an issue, and it is something that we need to get to grips with as a veterinary profession. So I said I'd talk about erysipelas. It is unlikely in lambs under a month old, but you will be aware, and your clients might have said, you know, if you look through farmers' blogs on the web, there's plenty of situations of farmers say, oh, use vaccination, it's made all the difference, I don't have joint ill anymore. Not particularly case controlled, or, you know, not particularly well set up trials, but some of what they say can look quite convincing. So all you can go on is the evidence. Is it when people have looked at it diagnostically, very few cases are erysipelas. If you do want to use the erysipelas vaccine, I would really, really, really strongly suggest you get a confirmed diagnosis and you consider all the risks and responsibilities associated with prescribing an unauthorised product. So just suffice to say, there have been cases where adverse reactions have occurred in use given erysipelas vaccine, and quite dramatic cases, quite severe numbers of abortions and deaths in use, and it's not an authorised vaccine, so the vet is held responsible. So please bear that in mind. Don't be very cautious before prescribing erysipelas vaccine, and I would suggest you get clients to sign to say they realise it's at their own risk. I would strongly suggest that. So going to the second case study, and this is a flock in Gloucestershire with an indoor lamb. These photos at the bottom, that's taken just last week, so they're lambing already this year. But this is the case is looking historically. So they don't routinely give in routine antibiotics, and they used to get occasional joint tills each year. Back in 2015, and a week or so post lambing, the first lambs that had been put out in the field were noticed with joint till. So the first day they caught 500. They caught 5 of them. There were about 100 born by then. They caught 5 of them and treated them with antibiotic and SAOD. And then over the next couple of days, they treated a further 25 lambs. So then, 5 days into the outbreak, they realised they had issues and thought they'd have to set up a plan. So they then ended up bringing 35 ewes in, brought them back into a clean yard, treated these daily. So this is treatment of clinical cases. They treated them daily with penicillin and gave them an analgesic. The remaining lambs in the field, they also received an antibiotic, so some metaphylactic treatment. And because they were only a couple of weeks into lambing, and they felt they had a major problem, they also treated all the remaining newborn lambs as they turned out the shed with a prophylactic antibiotic, targeted antibiotic. So, and then in that year, 2015, the outbreak stopped. Majority of the lambs recovered, except for those that needed to be euthanized. Now, most farmers in that situation, next lambing, would immediately turn to the bottle of antibiotics, and that's exactly what this farmer wanted to do. He was absolutely keen to start injecting every lamb as soon as lambing started. Instead, because he's married to a vet, he had to go through the plan, prevent, protect, considering the ewes, consider the lambs, consider the environment, do a risk assessment. Okay, so they knew the ewe's condition was good, but they need to monitor it continually. They knew they were feeding their ewes good, they had good protein quality in there, they didn't have any metabolic disease recorded, so they're quite comfortable about the ewes. They're also fairly comfortable about the lambs. Minimal intervention at birth, good hygiene, they cleaned out between each ewe, they applied their iodine as soon as possible and repeated it. So they were quite happy about the lambs. On this farm, they actually think that shed that you can see photographed at the bottom, actually they know that's poorly ventilated. It gets very damp, especially in bad weather, and they began to see the issues with the lambs associated with particularly wet weather. And in this farm, that is a major weak point. But I stress that is not the case on every farm, and that's where the devil is in the detail. So it's not always the same thing with joint till. The source, the root, you need to identify exactly what is happening and where, and cover all the bases. So it's not always bad weather. It was in this case. So they don't routinely use antibiotics, and they still don't, but they assess it routinely every lambing. So in 2016, the immediately following year, they did not have any cases and they did not routinely treat, in contrast to all those other farmers who would have just treated and would still be treating and would think they have to treat every single year. They didn't, and they got away with it. Last year, 2017, they did get some cases start. The lambs had been in the field for 7 days, and so they started to see those cases. They looked back at it, they discussed it with the vet, they worked out all those were born over a wet weekend, exactly the same risk factor they'd identified the previous time. they treated those cases and they monitored the situation, and the weather improved. They didn't have further cases. They managed to get away without prophylaxis, but they were absolutely ready to go in with prophylactic treatment if the weather deteriorated. So that is just demonstrating you can do it. You don't have to just routinely go back to prophylaxis. You just have to be measured about it. So this is my last slide. Once you have committed to plan, prevent and protect, and I don't mean you as a vet, I mean that is you discussing that with every single one of your sheep farmers, but it's for each farm, each flock to commit to plan, protect, prevent at lambing time. Then obviously we have a place for responsible use of antibiotics, and that is whether it's metaphylaxis or prophylaxis, as long as they're used responsibly. Any use should be targeted and always under annual veterinary review. So that's me, Katie. Do you want to go with some questions?
Thank you very much, Fiona. While I wait for a few questions to come in, I'd just like to remind you all that the presentations have been recorded this evening and will be available on the AHDB YouTube channels, as our previous webinars, if you want to recap yourself on anything that's been mentioned by Fiona this evening. And if you'd like copies of the presentations, either the short version or the longer version developed by Fiona and Flock Health, then please do email the brp@ahdb.org.uk email address, and we can get those sent out to you, along with the calculator that was developed with Nottingham. That's also got an easy to use guide we can send you as well if you want to do that with some of your clients. So the first question that's come in, Fiona, is which colostrum products are best and which ones should they be recommending?
Oh, that's classic that you asked me that.
How long a piece of string?
Yes, no, and I do have that in a different Flock Health Club event presentation. So there are two studies. Probably the most reliable was Murray Cork's, and I'm pretty sure off the top of my head the Downland one was good, and the Ovicol, but I would have to just check that. So it varied during the year, but I think consistently in both the studies, one was 2011 and one was 2015, that the Downland one was good. The Volac one was good. But I should probably not keep mentioning names without being absolutely sure. So I might have to get back to people about that.
Okay, no worries. And has there been any work on the growth rates of lambs treated with oral antibiotics as neonates and those that haven't? And obviously if the effect of the antibiotics affects the gut flora and then the later feed conversion rate, then that's obviously a good argument for telling clients not to be using it.
Yeah, that would be great. And I haven't seen any work in lambs. There has been work in calves, and there was a chap over in the International Sheep Conference speaking about the biome of calves and the effect on the biome of antibiotics. And so they have done stuff in antibiotics in neonatal calves and shown that it affects gut flora very definitely. And other people, somebody from one of the labs was chatting to me a year or two back about the possibility whether we see more joint ill in lambs that have had their gut flora affected by giving oral antibiotics. So I don't have definite evidence to show it, but I'm convinced that it's not something you want to give to lambs just for the sake of it, because there's a reason the gut flora is as it is, and killing off all the bacteria isn't necessarily the best thing to do. So I would watch this space, and I wouldn't be at all surprised if we get some good work out on that in the next few years, but I can't quote you something at the moment.
Okay, the charcoal swabs are they taken from the rectum or the small intestine?
I think sometimes it depends where you can get some. If you've got a post-mortem in the small intestine, it's great. If you've got live lambs and you're taking a sample of scour, then actually, if you're doing scour, I would be as inclined to use the rainbow strips. We were looking for Cryptosporidia, and we found they were really effective. And we also were going to the lab, and we got extremely high correlation between the strips and the lab. So I really like those strips, and those were just samples of scour taken from the rectum. If you've got a post-mortem and you can get a small intestine sample, that's great. Or you swab the liver, which for actual watery mouth is appropriate. I would sear. I would use a hot knife and sear it first before I took the swab of the liver, just because of contamination.
Okay. Someone said about suggesting all farmers give lambs more colostrum rather than reaching for specdam. So I suppose that's just, I'm not sure you need to say any more on that one, but I guess that's a given. Every lamb needs its quantity of colostrum before reaching for antibiotics, because that's not going to substitute.
And that's going to be the sort of thrust of this campaign over the next month. So they've got stuff going into lamb, beef, pork, right across all the sectors. This colostrum is gold. We're trying to push it for everybody, so everyone kind of gets the same message. I'd agree with that.
Okay. Is there any chance of advising which artificial colostrums have the best levels of IgG? Is that the information that you think you've got in some studies?
Oh, I've definitely got that information. It's just on I've definitely got it here. I just can't access it at the moment with the webinar going. So, yeah, there are 2 studies. So we have it in our Colostrum Flock Health Club presentation, which some people might have already used, but I can go back through. I sort of didn't want to focus this one on colostrum, but inevitably it has. So I can go back and find that information.
Okay, we can send that around to everybody that's registered, so that's not a problem. A question, this is from a Dutch vet working in Ireland. Let me just, I've got lots of questions actually. That one is very, very long, so let me digest that one while you answer another one. What level of total protein would you advise as a minimum when blood testing young lambs for a positive transfer?
You're aiming for 50. Yes, 50, which I assume is grams per litre. Hang on. Yes, it's 50. I can't think the units.
Okay. What would you recommend to reduce tags leading to joint ill?
Very good question. So don't assume that a packet of tags is sterile. It's not. So often, they're on a dusty shelf, or even if you open the bag, they're not sterile. And we know well that Streptococcus galacti can survive well on dry straw, on dried, in dust, on tags. So sterilize them before you. So I would sterilize the ear and I would sterilize the tag, and I certainly wouldn't take that for granted. Just because it's it's come out of a packet, it is not sterile. So, and bear in mind, if we were doing any other procedure in veterinary medicine that we broke the skin, we would use good sterilisation first. We wouldn't just clunk it in with dirty hands and birth fluids everywhere and everything. So, yeah, try and be as sterile as possible.
Okay. The long question from the lady that's that I just mentioned from the Dutch vet is, do you think that sheep farmers and vets will significantly change their habits of prescribing and using critical antibiotics if there are no strict rules or regulations by government?
Oh, that's a very good question. So when we started the RUMA Targets Task Force, it was sort of said, government has to do something, And if we don't decide as a sector to voluntarily do something, hard legislation will be put in place, and either we'll lose the right to prescribe as we do, or and I suppose that's up to all of us to be responsible about it. And whether it's enough, I don't know. It's certainly not nearly as much as they've done in Holland and some of the other European countries. Yeah, I don't know whether I want to say whether I think that's good or not. We are where we are, and on the case and do something about it. If we don't, the matter will be taken out of our hands, I imagine.
Okay, we've got more and more farmers lambing outdoors. What would your main focus be on the environmental control for reducing watery mouth out when they're lambing outside?
Still, you've got you still got exposure, shelter. The weather makes a massive issue there. So then you might go from low risk to high risk because you are very weather dependent. So that's where you need your risk assessment, and you need to be actively reviewing it as you go through lambing. So I don't see any issue with us using more prophylaxis in bad weather. What I think the issues are is that we currently are quite habitual and use it all the time, whatever the weather or whatever the conditions. So yeah, it's just a case of being sensible about it and going in it. And if you can find a drier, more sheltered field, so much the better. But sometimes those matters are out of our hand. Unfortunately, we can't do anything about the weather, or but those sort of issues, and also stocking density, obviously.
Okay, if using cows pooled colostrum, should we try and identify yoni-free cows?
Oh yes, ideally, brilliant. Yes, absolutely. Yeah, I know the substitutes. There was some interesting, one of the studies just looking between substitutes they found. They were also checking yoni status and not always finding it was yoni's free. So yes, yeah, that kind of is a given.
Okay. Is it useful to take blood profiles of ewes pre-lambing, and if so, how soon before lambing?
Yes, I think it is useful. I actually think it's a bit late by then, so I would really encourage people to be actively involved with sorting the nutrition, months before that. So the best time for blood profiles is probably 3 weeks before lambing, because you've possibly got some chance to do something about it. Too much before that, and really it's only in those last 3 weeks that protein is really, really important. So you're not going to, yes, you can see beta hydroxybutyrates, but so as a compromise, I'd say about 3 weeks, but really I'm much more in favour of getting in there and making sure we've got good balanced energy and protein within the nutrition. The ration is properly sorted, and then just using the metabolic profiles as a check. I wouldn't like to rely just on metabolic profiles, because if you find the wheels have gone off at that stage, you can't necessarily do enough about it in time.
Okay. Is there a Sheep Pacific rainbow test, or is it the calf one that you use?
No, they sell a Sheep Pacific one, but it's worth pointing out the rotor part of it is the same as the rotor on the calf. So they sell it as a small ruminant package, but and I've definitely had rotor positives on it, but it's not specific for sheep. So I wouldn't like to use it for a study into it. I think a positive's positive, but I wouldn't know if I'd got about my false negatives. It's sheep specific.
Okay. What's your view about injecting sheep post-assisted lambing?
I think that depends on on how worried you are with hygiene and everything. So I wouldn't say absolutely do it as a matter of routine. If you've got a mucky situation, or you've got, there's damage occurred, I would go in with an antibiotic and definitely an analgesic, because you want that ewe to be milking and you want it to be in little pain as possible. I would probably put the analgesic before I put the antibiotic, unless you've got particularly poor hygiene.
There's a couple of people asking about where do you actually get the rainbow strips from, and are there specific companies which you'd recommend?
Oh, I ordered a load from
They've only
Belgium.
been able to source the cattle ones before.
Okay, it's worth just, so they're made by Bio, B-I-O and then capital X. I would Google them. I got a load imported from Belgium, I think, but so I don't know anyone who supplies them in the UK, but I don't expect it to be a problem. They would probably put you onto someone, either someone who would supply them in the UK, or yeah, I don't see a problem getting hold of them, but I couldn't specifically tell you who in the UK would supply them at the moment.
Okay. Is there any evidence for additional probiotics in artificial colostrum?
I don't know of. I haven't seen good evidence, but that doesn't mean it's not there. I have not seen published evidence for it. So I'm afraid the answer, I don't know.
Okay. This one's slightly off topic, I suppose, of what we're talking about, but how do you treat and manage crypto cases?
Oh.
You don't have to answer it, as it is slightly off course.
You can, I don't know if you can say you can use Helicure, so that's unauthorised. It's not licensed in sheep, but people do at the same dose as cattle. Bear in mind, Helicure is fairly toxic if you overdose it, and it's the same protocol as calves, although, as I say, that's unauthorised. We found, in the study we did, we found very low levels of crypto. So I'd say it's a problem in pet lambs or in lambs that have been in for a long time. Lambs that have turned out quickly, we didn't see it as an issue.
Okay. What would you use to sterilise the ear tags before inserting?
Alcohol or 10% iodine, strong iodine, or just surgical spirit. That's what I'm trying to think of. Or even under pressure, I would probably clean the ear and spray with some blue spray. But they only need sterilising. It doesn't need topical antibiotic.
Okay. You mentioned using lime in the pens, and someone saying they had a great success with minstrel powder last year, and over half, and that reduced the use of spectrum by over half.
Brilliant. That person, if they could, we're looking for good case studies for the farming press. So if whoever reported that wants to get back with details, that those sort of case studies are really great for putting on the Farm Biotics website, and for RUMA to use. So please do get back in touch. But yes, anything that raises the pH, reduces, just dries things out and reduces the challenge is good.
Okay. Would you consider pasteurising pulled cow's milk, or would that destroy the antibiotics? The IgG levels even.
I'd be cautious with pasteurise. It depends what heat you're going to. I would be cautious going too hot. That's why your microwave has a problem with denaturing the protein. So absolutely go for disease status, like the Yoni's question before, but it depends what you mean temperature-wise with your pasteurisation. I think I would potentially be cautious.
Okay, and I think there's just one other question that I haven't answered about, is there any research on the addition of yeast in used diet?
There is research.
Slightly off course.
Yeah, there is research. I'd say indirectly it's great for rumen function, but I wouldn't specifically, in context of what we've been talking about and quality of colostrum, I don't know of good published data. As I said before, that doesn't mean it's not there, just I don't know about it.
Okay, well, thank you very much, Fiona. That's been great. Just a reminder, there is also the Reducing Lamb Losses manual, which can be found on the Beef and Lamb website, along with some video clips which you may find useful for your clients. And also thank you for everyone. We've had a great turnout and participation with lots of questions this evening. Thank you. We will the presentations, once it's been saved, will get sent out to you all. That's obviously registered. And we have 2 more vet webinars at the end of the month on feeding the ewe. So it's such a big topic, we split it into 2. So we will be sending the invites out for those shortly. So it'd be great if anybody wants to listen into those. And hopefully this will be able to help you with some information to help your clients reduce the overall antimicrobial usage within the stock that you manage within your practice. So thank you very much for listening, and hope you all have a lovely evening.
Thanks, Katie.
Thank you.